Hi guys, I am back with another video. Um, let's do this. Okay, so we have now this PPT. So now we are going to discuss general anesthesia. General anesthesia is a irreversible state of CNS depression characterized by unconsciousness, anesthesia, amnesia, skeletal muscle relaxation, and loss of reflexes. Drugs used as general anesthetics are CNS depressants. Okay. So potent general anesthetics are divided into inhaled and intravenous groups. General anesthetics inhaled we have two types: gas, nitrous oxide and xenon, and volatile liquids, halogen, sevoflurane and isoflurane. And intravenous we have the barbiturates, thiopentol, dissociate, dissociative ketamine, miscellaneous propofol, and opioids, fentanyl and benzodiazepines, midazolam, lorazepam, and diazepam. So, what are the goals of the surgical anesthesia? Muscle relaxation, loss of consciousness, and automatic stabilization. Okay. So, for patients undergoing surgical and other medical procedures, general anesthesia provides these five important benefits: sedation and reduction of anxiety, lack of awareness and amnesia, skeletal muscle relaxation, suppression of undesirable reflexes, and uh, analgesia. Okay. So now general anesthesia allows adequate surgical access to the operative site. Risks: with modern advances in medication monitoring technology and safety systems, highly educated anesthesia providers, the risk caused by anesthesia to a patient undergoing routine surgery is very small. So we have we have four stages of the anesthesia. First is the loss of pain sensation. The the patient can't feel any pain in the body. Then we have the competitive behavior. It means that there is a excitement of the patient, and yeah. And third one is the surgical anesthesia. This is the phase in which the operation is performed, and yeah. And fourth stage, it is very dangerous, and it is usually avoided by the anesthesiologist, medullary paralysis and death. Okay. So stage one, anesthesia, loss of pain sensation results from interference with the sensory transmission in the spinal column tract. Stage two, excitement. There is a rise of and irregularity in the BP and respiration, as well as risk of laryngospasm. Stage C, surgical anesthesia, surgical intervention. There is gradual loss of muscle tone and reflexes as the sinus is further depressed. This is the ideal stage of anesthesia for surgery. Continuous careful monitoring is required to prevent undesired progression into stage 4. The stage 4 medullary depression paralysis, severe depression of the respiratory and vasomotor centers occur during this stage. Death can rapidly ensue unless measures are taken to maintain sufficient respiration. So. Traditional mono anesthesia versus modern balanced anesthesia. Mono anesthesia diethyl reduce pain sensitivity, analgesia, loss of consciousness, muscle relaxation, paralysis of vital centers, and balanced for unconsciousness, hallucin or propofol if needed, or autonomic or stabilization, atropine or esmolol. Okay, esmolol, we have studied that esmolol is a beta one blocker. Okay, for analgesia and two or fentanyl, and for muscle relaxation pancuronium. So we have basic terms: inhalation and anesthesia. Anesthesia induced by inhalation of a drug. Intravenous anesthesia. Anesthesia induced by intravenous administration of a drug. Balanced anesthesia. Anesthesia produced by a mixture of drugs, often including both inhaled and intravenous agents. Analgesia are a state of decreased awareness of pain, sometimes amnesia. So, general anesthesia can be divided into three stages: induction, maintenance, and recovery, followed by pre-medication. So, pre-medication, fentanyl analgesia, diazepam, anxiolysis, midazolam, unconsciousness, muscle relaxation, intubation, isoflurane, nitrous oxide, pancuronium, muscle relaxation. Okay. And recovery, neostigmine, reversal of neuromuscular blocker, and fentanyl uh, analgesia. Pre-anesthetic medication serves to calm the patient, relieve and protect against undesired effects of a subsequently administered anesthetic or the surgical procedure itself. For example, H2 blockers like famotidine to reduce gastric acidity, benzodiazepines like midazolam to allay anxiety and facilitate amnesia, opioids like fentanyl for analgesia, antihistamines like diphenhydramine or for prevention of allergic reactions, antiemetics like ondansetron to prevent nausea and the possible aspiration of stomach contents. These agents facilitate smooth induction of anesthesia and, when administered concurrently, lower the dose of anesthetic required to maintain a desired level of surgical anesthesia. Induction is a critical part of the general anesthesia. It is the transformation of a waking patient into an anesthetized one. It is analogous to an airplane taking off, and anesthesia provides a piloting all. Yeah. Okay. This stage, induction is achieved by intravenous injection of induction drugs that work rapidly, like propofol, which induces unconsciousness within 30 to 40 seconds after injection, by slow inhalation of anesthetic vapors, sevoflurane or xenon, delivered into a face mask, or by combination of both. Induction is carried by the propofol and sevoflurane or xenon. Mhm. Opioids like fentanyl, most patients receive an injection of an opioid analgesic like fentanyl. Induction agent and opioid works synergistically to induce anesthesia for securing the airway. For securing the area, induction often includes co administration of an IV skeletal muscle re- relaxants like rocuronium to facilitate intubation and muscle relaxation for the abdomen and thoracic surgery. Long-acting long muscle relaxants are administered. Okay. Okay. Maintenance is the most stable part of the anesthesia, providing a sustained surgical anesthesia. It is commonly maintained by the administration of volatile or gaseous anesthetic, which offer good control over the depth of anesthesia. Understanding that anesthesia is a is a continuum of different depths is important. Depth of anesthesia is the degree to which the CNS is depressed and is an useful parameter for individualizing anesthesia. Opioid analgesics like fentanyl are often used for pain relief along with the inhalation agents because the latter are not good analgesics. Excessive anesthesia depth is associated with the decreased heart rate and BP and can be fatal. Excessive anesthesia results in lower awakening and more adverse effects. Induction of anesthesia depends on how fast effective concentration of the anesthetic drug reach the brain. Whereas recovery is essentially the reverse of induction and depends on the how fast the anesthetic drug diffuses from the brain. Okay. Anesthesia protocols because no single agent provides all desirable properties. Several categories of drugs are used in combination to produce optimal anesthesia. For extensive surgical procedures, anesthesia protocols commonly include internal drugs to produce anesthetic state, propofol and thiopurine sodium, inhaled anesthetic with or without IV agent to maintain an anesthetic agent like isoflurane, nitrous oxide fentanyl, or droperidol, neuromuscular blocking agent to effect muscle relaxation, rocuronium, succinylcholine, skeletal muscle relaxants facilitate intubation of the trachea and suppress muscle tone to the degree required for surgery. Mechanism of action. Currently, anesthetics are thought to produce anesthesia by interaction with the receptor targets, most commonly GABA A activates and possibly other receptors like N-methyl D-aspartate and MDA subtype blockade of the glutamate receptors, which potentiate inhibited neurotransmission and inhibit the excitatory neurotransmission respectively. Mechanism of action. So no specific receptor has been identified as the locus of general anesthesia. The focus is now on interaction of the inhaled anesthetics with protein comprising ion channels. Inhaled anesthetics, barbiturates, benzodiazepines, propofol, pacilide, gamma aminobutyric acid, GABA, mediated inhibition at GABA receptor block brain NMDA receptor, and methyl D-aspartate at moderate to high concentration. Most inhaled anesthetics also inhibit nicotine acetylcholine. Okay. Hmm. Binding of GABA causes the chloride ion channel to open, causing hyperpolarization of the cell. Binding of GABA is enhanced by okay. inhaled anesthetic, achievement of a brain concentration of an inhaled anesthetic necessary to provide an adequate depth of anesthesia requires transfer of the anesthetic from the alveolar air to the blood and from the blood to the brain. Thus, the alveoli are the windows to brain for inhaled anesthetics. The rate at which a therapeutic concentration of the anesthesia is achieved in the brain depends primarily on the solubility properties of the anesthetics, its concentration in the inspired air, the volume of pulmonary ventilation, the pulmonary blood flow, and the partial pressure gradient between the artery and mixed venous blood and anesthetic concentration. Alveolar to venous partial pressure gradient of the anesthetic is the driving force of anesthetic delivery. It is the driving force that moves the anesthetic into the alveolar space and hence into the blood, which delivers the drug to brain and various other parts of the body. Okay. Minimal alveolar anesthetic concentration max. The potency of the inhaled anesthetic is best measured by the minimum alveolar anesthetic concentration. The more the lipid solubility of the anesthetic, the lower the MAC. और ओ अच्छा मतलब जितना ज्यादा लिपिड solubility होगी उतना उतना कम मैक होगा. ओके. जितनी ज्यादा 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 लिपिड solubility, come back and come concentration of the anesthesia required to produce the anesthesia and the higher. Oh अच्छा, okay, so more the ज्यादा ज्यादा अगर वो ड्रग की ज्यादा लिपिड सोलिबिलिटी होगी तो क्या होगा कि अपना मैक जो है मतलब मिनिमम एल्विलर एनेस्थेटिक कॉन्सेंट्रेशन जो है वो कम होगा, मतलब कम लगेगा, ठीक है. Which is required to produce anesthesia and thus higher the potency of the anesthesia. ठीक है. मतलब इसमें से क्या आपने को समझ में आता है कि जितनी ज्यादा लिपिड सोलिबिलिटी रहेगी ये एनेस्थेटिक की, उतना उतना ज्यादा उसका हायर पोटेंशियल होगा. Pharmacologic effects of inhaled anesthetics. CNS effect, they increase the cerebral blood flow. Cardiovascular effect, decrease the arterial blood pressure moderately. And fluorine and halogen decrease cardiac output. Others cause vasodilation. Wait, what? Look, CNS effects, they increase cerebral blood flow. ठीक है. Cardiovascular effect, decrease arterial blood pressure moderately. Okay. ठीक है. And fluorine and halogen decrease cardiac output. Others cause vasodilation. Thus, anesthetic agents suppress cardiovascular function to increase respiratory effects on all inhaled anesthetic decrease respiratory function. Therefore, the condition of the patient's respiratory system must be considered for all anesthetics. Most inhaled are bronchial, but less is a pulmonary. ओके, ठीक है. Desflurane pulmonary irritant है. Okay. Liver and kidney, the release of fluoride bloom and other metabolic products of the halogenated hydrocarbon cannot dissolve, especially if the metabolic outcome with the exhibited and over time. Pregnancy. Special precautions should be kept in mind when anesthesia and adjunct drugs are administered to a pregnant woman in early pregnancy. Potential effects of the on the organogenesis in the fetus are major concerns. Transient use of अच्छा ओके abletion anemia. Oral have occurred in the fetuses of women who have received benzodiazepines during early pregnancy. Benzodiazepines should not be used routinely during labor because of the resultant temporary hypertonia and thermoregulation in newborn. Okay. It is mentioned in here anesthesia is termed and those are okay. Post-operative hepatitis after anesthesia to tissue toxin. Okay, malignant hypothermia and C plus neuromuscular blockers in a very small percentage of a susceptible patient exposed to any of the halogenated hydrocarbon and free other immunology. Hmm. Use of dentally and the avoidance of triggering agents for the world hallucination and cities and sustained pain. Mm-hmm. Harassment with the recognition of the adversity it is not giving Distillery and fluent mm-hmm. With oxygen, especially after the rectal intubation admit with refill hypoxia. Antonox is a homogeneous mixture of oxygen. Oxygen and mm-hmm. It's and she's very strong. Uh, okay. Also, it's not different. So, Halogen is the inhalation volatile liquid. Halogen is indicated for the induction and maintenance of oxygen. Is either oxygen or oxygen and natural oxygen. Okay. Yeah. Consider the heart dis discrimination of critical elements. Okay. Okay. Uh, uh, okay. Nah, I think so. Okay, guys. So I will take a break now, and we'll continue the stream. So stay tuned. Stay tuned. Stay tuned. Okay.